Good morning and welcome to COVID Talk with our local health authorities. With us is Dr. Maria Rivera representing Harris County, Dr. David Persse representing the city of Houston. Thank you to past President Kathy Finninger, Rotary Club of Houston, for providing these questions. I will also want to give a special thanks to Ash Morgan, who's helping us put this together here in the office. I'm Stephen Williams, the director of the Houston Health Department. Actually, the first question comes to me. I did not get an email about my second vaccination that should have been this past Monday. The Houston Health website was finally updated to say if you didn't get a link, just show up. It's just the new method. Actually, that's our fail-safe method. We are asking everybody. We should be sending out a text or email to you within 24 to 48 hours of the due date for that second shot. If you don't get that, we're asking people to call 832-393-5109, 832-393-5190, excuse me, or hhdcovid19.crt@houstonpx.gov. So, and if all of that fails, just show up at one of our sites and we'll give you that second shot. But just make sure that it is a second dose site. Let's go on to our second question. CDC recommendation for J&J is apparently scheduled for Friday. What do you think will happen? Okay, docs, take out your crystal ball and tell us.
Well, Fauci, I'm just going to repeat basically what Fauci said. He said he expects that it'll come out with approval, perhaps with a recommendation or a warning or some sort of qualifier. The European Medical Association or whatever their title is, I think that's what it is, the European Medical, they have started using it in Europe again. So we'll have to wait and see. But I think it'll come back, but with some sort of an asterisk at the end.
Actually, I saw a couple of comments from people saying that we should have never paused and we should have kept going because we could have been saving lives. I think that was a commentary in the newspaper this morning. A doctor who worked on the J&J trial said people have a higher risk of developing a blood clot from COVID than getting the vaccine. Do you agree that the benefit outweighs the risk?
Look at the actual numbers. The chance of getting a clot in general, if you have COVID, is much higher than the chance of getting it from the vaccine, and so that's definitely true. I think that the one caveat of why the vaccine was paused is because the type of clot that's associated with the J&J vaccine is just an uncommon clot in general, and I don't know if that specific type of clot is more common in COVID, but I presume it is. In general, clots with COVID-19 are much higher. And so we'll wait to see what the committee says about the risks and the benefits. My guess is that there, like Dr. Persse says, there's going to be some form of asterisk. And so when weighing the risks and the benefits, it'll depend on what that asterisk is and what that means for you as an individual. We know that it's more common in women. We know that so far it's more common in women below a certain age. And so that may help weigh the risks and the benefits of that particular vaccine versus some of the others.
But this phenomenon is not just about the clot, it's also about it's in people who have thrombocytopenia, really low platelet levels. And that combination is really, really rare. And so they're seeing it. So part of the question is there something that we can learn so that even though it is exceedingly rare, is there a way to prevent it from happening at all related to the vaccine? And then the other complicating thing is these clots are often treated with heparin, which appears maybe yet another risk factor. So the point is, the good takeaway is that there's a system in place to detect really, really, really rare complications from the vaccine. So all these people are saying that your hair falls out, you're not gonna be able to have kids, and all these other crazy things. If that were the case, they would have absolutely caught it, because we're catching something which is literally a 1 in a million complication. But they're also being responsible because they're looking at making sure that the standard therapy for this may actually make things worse. And so they're making sure that's determined so that when people do get this rare event, that the clinicians don't, unknowingly then make it even worse. And so I think what the takeaway from this is there are tremendous safeguards in place regarding vaccines today.
The European Medical Agency Safety Committee concluded it should add a warning to label about blood clots with low platelet count for J&J, the same as it requires of AstraZeneca. Benefit still outweighs risk. Would you recommend that those over 50 years old receive it. I think, Maria, you referenced an age group earlier, and David, you brought up the low platelets.
We'll wait and see what our committee says as well. But I agree, there probably will be a recommendation for a certain age group or just some other qualifications, and I think that's probably what we'll expect to see.
Okay. Has there been any trial data on safety mixing brands for first and second dose of Pfizer and Moderna? That issue came up with us this week because we had people showing up with the doctor's note recommending that they get another brand of vaccine because of the reactions that they had to the first dose.
My initial knee-jerk reaction is that depending on what reactions the patients had to the first vaccine, I can't. I mean, if they had some really horrible reaction, then we need a conversation. But if you were infected with COVID and you didn't know it, and then you got your first shot, you can expect to have a reaction like many people are getting with their second shot, because your infection sort of served like the first shot and it primed your immune system. So, without knowing the details, I'm a little disappointed if our colleagues are thinking that people are having a problem with the vaccine because they had a reaction to the first shot, when actually that, is something to be expected. So, but I don't know the details, so I may be overstating it there. To the question, there are trials that are ongoing looking at mixing the mRNA vaccines. I have not heard of any results, unless Dr. Rivera may have, but I've not heard any of the results of those yet.
No, I looked real quick to see, and I haven't seen any results.
That's something that we're going to be facing, because people are showing up with doctor's notes saying, please do this.
Yeah, and I think the only caveat, and we're not in the position right now, but the CDC did put out some recommendations for people that if they had an allergic reaction to Pfizer or Moderna, then they could potentially receive a Johnson & Johnson vaccine to complete their series, quote unquote, or just instead of. And there's some language around that, but right now with Johnson & Johnson paused, if you had an allergic reaction to Pfizer or Moderna, then the recommendation isn't to get the other one. But it's in those very rare cases when you have a true allergic reaction, because I totally agree with Dr. Persse. If the reaction is that you had a fever or chills or some of the expected things, then we definitely wouldn't make that recommendation.
Just had a text question to come in. Why should we trust a company that knowingly caused cancer in people due to asbestos in their product, which they were aware of for decades?
And I think that it is healthy skepticism is a good thing. Unhealthy skepticism obviously is not. So it's a valid question. The one thing that I would say is that there is so very much attention to what's going on with these vaccines right now, that if somebody were being irresponsible, I can't imagine that it wouldn't quickly come to light.
My sister is so traumatized by the anticipation of getting a vaccine. I fear she will end up willing herself to get more severe side effects. Can you make yourself sicker through stress sometime?
Yeah, I could take that one. So my mother-in-law, and just a personal anecdote, but my mother-in-law was extremely fearful of the vaccine. And when we took her to the site, we took her to NRG Park to get her vaccine. And she did get the Johnson & Johnson vaccine, actually, because she said if she's going to do it, she's only going to get one dose, because she was so nervous. And she was feeling nauseous, lightheaded before she got the vaccine. And she was like, I think it's the vaccine. We're like, you haven't even gotten the vaccine. But yes, if you're having signs of stress and anxiety, they can manifest as some of the reactions that you might see. And we have seen that already on the sites, like people getting more lightheaded afterwards, dizzy, nauseous, and often it's related to that stress and anxiety. And so I think the recommendation is to, maybe she shouldn't go by herself. Someone go with her, try to distract her afterwards, perhaps bring something to eat or drink right after the vaccine, because a lot of people we have noticed, we've seen some panic attacks even afterwards, and so you definitely can give yourself some of the reactions, or your body just reacts that way due to stress and anxiety.
The human body is truly amazing. And so one of the things is that you can actually, due to stress, people can actually manifest physical signs, not just symptoms. A symptom is something I complain of, but you can actually get physical signs. So people from stress can break out in rashes. People from stress can develop true bronchospasm. So it's not just, and as an emergency physician, I deal with this not on an uncommon basis, trying to sort out, is this a real pathology, or in this person who has a history of these things, is this their anxiety becoming so powerful it actually causes their body to do things that you would think the mind could not do, and it is possible.
A month after I have had COVID, I'm having major stomach issues, and eating many things make me feel ill. Foods I used to love taste awful. Is that common?
So I'll take this one. I wouldn't say that it's common, but what this person is describing is certainly not unheard of. We're seeing a lot of unusual symptoms, and some of these have been in the news, like the persistent headaches, the loss of sense of taste or smell, or a changed sense of taste or smell. And in this case, sounds like a change in their taste. This one thing about this virus is that it is rewriting the rules on what kind of problems viruses can cause, both in the short term and in the long term. So I wouldn't say it's common, but what she's describing, I've actually heard it before.
Post-COVID, I feel dehydrated even after drinking quite a bit of water. Is that normal?
So it's not, there's a whole range of what we call the post-COVID syndrome or COVID long haulers. And some people do report feeling more dehydrated. Some people report feeling really low energy, really fatigued. They can report, like Dr. Persse said, the loss of taste or smell. And if it has persisted since you had COVID, I would probably be more, it may be related to that. If you were totally fine and then suddenly started feeling really dehydrated, then I wouldn't attribute it to COVID. Definitely see your physician.
Experiencing a ringing in my ears as an after reaction. Is that unusual?
The famous one here in Texas was the gentleman, his name escapes me, but he owned Texas Roadhouse restaurants. And his was so bad that tragically he took his life. I would absolutely not recommend that anybody do that, but the ringing in the ears is something we've heard of before. Again, this is one of these neurological, so the sense of taste and smell, the headaches, sometimes people are feeling, unsteady gait, a lot of neurologic symptoms, and some of these are very prolonged, lasting, up to months. So this is, it's not common, but I wouldn't say it's unusual.
JAMA article says 30% of COVID patients are symptomatic up to 9 months after the infection. Is there any test that proves they are no longer contagious?
We try not to continuously test people for COVID because some people do have persistent positive tests, and that doesn't necessarily mean that they're contagious. I think when the studies of contagion have been done, after those 10 days of isolation, the chance of being contagious is really, really low. And what we think is, even if you have these long-lasting symptoms for 9 months, that you're not actually contagious at that time. But like Dr. Persse said, this virus is kind of rewriting all the rules. It's unusual for anyone to have symptoms of any kind 9 months after contracting a virus, and this virus has really showed us that is happening, and it's not uncommon. But we don't think that if you have those symptoms long term, that you're still contagious.
Not much is being said about convalescent plasma. Are donations still sought?
So I'll take that. I don't know that donations are still being sought. The blood bank, at least here in Houston, at the blood center, they've got quite a cadre of folks now that I believe are donating, platelets and plasma and so on and so forth. One of the things is that the convalescent plasma, the research has been pretty mixed. It has not been the panacea that we had hoped. And then the other problem is even giving it is very work intensive, and so there are not a lot of places that are doing it because it's not like just giving somebody a vaccine. There's a lot more to it, and the outcomes are kind of mixed. It's not been as effective as was originally hoped. So if you want to give, I would reach out to the blood center here in Houston, or probably any of the blood donation centers or the hospitals, and see if they're asking. But I've not heard of anybody. Nobody's come to us to try to and they did in the beginning. They asked us to try to promote that, but I have not had any requests in months at this point.
5,800 fully vaccinated people have caught COVID in the U.S. 74 died. Are numbers of COVID breakthrough cases increasing post-vaccination?
It's still very, very low, like less than the numbers that I saw today were less than somewhere around 0.008% of people that have been vaccinated have had a breakthrough case, and the numbers of hospitalization and death are much, much lower than that 0.000 something. I think that this is what we, unfortunately, no vaccine is 100%, and so we'll expect some breakthrough cases. There definitely is a concern that as the variants continue to circulate in our community, as new variants are discovered, there is the potential for more breakthrough cases. And so I think that this is something that obviously we're all monitoring, and why it's so, so important for everyone to get their vaccine, have their family members get their vaccine, their friends get the vaccine, everyone get the vaccine.
Do we have any indicator if these breakthrough cases are from variant? And you just commented on that. EU is pushing for a digital green certificate to ease travel and show proof of vaccination, negative test, or recovery from the virus. I will get this for travel, but fear the lack of coordination amongst countries.
You know, that's as much of it's probably more of a political question than it is a health question. But one of the things that we have seen has been an increase in cooperation among countries to a point. The European Union, as an example, seemed like they were getting on quite well in the beginning of this, and then more recently I've seen some more divisiveness in policies from one country to the next. But when it comes to something like this, I would like to think that the World Health Organization would then become that common denominator to help make sure that the standard for whatever digital certificate is the same or similar across nations. And that's one of the great values of having something like the World Health Organization. It's another good reason why we need to support it.
Scientists in Israel identified 6 cases of a herpes zoster skin rash following the Pfizer vaccine. Does it appear there's a connection with COVID and shingles?
Especially in a country like Israel, where there's been so many people vaccinated, they've done an incredible job with vaccination, that they are going to be able to identify some of these relationships. And I think at least the last that I heard about this, and Dr. Persse, you may have heard something different, but I don't believe that it's confirmed that the vaccine led to possible shingles cases. It's just, at this point, it's just a relationship that they haven't proved any form of causation there.
Right. One thing to remember about herpes zoster is that it is, well, first of all, it is a DNA virus, and there are DNA viruses out there. You generally get infected, as a child, and you're symptomatic of the disease known as chickenpox, and then it remains dormant, and it will reactivate when you are under stress and in people who are immunocompromised. And in fact, my understanding is that these 6 cases, these were in 6 individuals who were immunocompromised, or on medication for it. And then if you become stressed, so herpes zoster is it's like a breakthrough complication, right? And so having no idea, what was going on with these individuals, what was going on in their life, that may added stress, but they were immunocompromised to begin with. So they're tragically, they're a perfect setup. Whether they became infected with COVID and that was what set them off, they say they were vaccinated, they were a breakthrough case, they got infected, developed the symptoms, or whatever happened. So again, there's 9 million people, I believe. The population of Israel is around 9 million people. And so for 6 cases of herpes zoster and somebody who either had or was recently vaccinated, it's probably not a big surprise at all.
Lancet is seeing infections lower risk to 85% against infection. Not the same antibodies, though.
Yeah, and that sounds similar to what we've heard from those who have done the studies. Not the same antibodies, though. Well, so one thing to remember is when you get vaccinated with the mRNA, you're developing antibodies specifically to the spike protein. When you're infected, you will develop antibodies to the spike protein and perhaps some other things that are on the virus. So that wouldn't be a huge surprise. There may be some additional antibodies, but I would still think you'd have antibodies to the spike protein. Remember, that's the nasty one. That's the thing that causes the virus to be able to infect the cell. And so that's the one we want to knock out.
One local in the news doctor said, when we get to where everyone wants to get a vaccine, you can take masks off. True?
So I think that's an interesting comment. I think we're going to continue to recommend masks until the majority of the population is vaccinated, until we reach that herd immunity and the cases have gone down significantly. But I think one discussion that I know Dr. Persse and I have had with some of our colleagues is, if we only get to a certain level of immunization, what does that mean?
Mm-hmm.
And so at this point, we're definitely not recommending you to take off your mask, even if a certain number of people are vaccinated, until the numbers are significantly decreased and the WHO or some form of world organization declares the pandemic is over.
And it's to some degree, it's a question without an answer. It's kind of like, when is the pandemic over, right? And Dr. Rivera and our colleagues, we've talked about this. And so, for example, there's a report this week that in Galveston County that they're suspending their max vaccination clinic, and they'll be sending some vaccine back to the state. And so what does that mean? I mean, that theoretically, that would suggest that everyone in Galveston County who wants to get vaccinated got vaccinated, right? Well, we believe, based on the information we have, is that, and again, herd immunity is not a on-off switch. It's a dimmer switch. So there is some degree of herd immunity in Galveston County, just like in Harris County. And so there's the opposite. There's some degree of not herd immunity, right? So what do you use to decide whether or not you should wear a mask or not? And the other conundrum with this is the mask you wear protects you a little, but it protects the person next to you a lot. The flip side of that is the person next to you without a mask, they're the threat to you, whether you're vaccinated or not, but more so if you're not vaccinated. And so this becomes really an extremely difficult question to answer, and it's going to go to it's going to go to when people are at a point where they're willing to take the risk. What is the risk? Well, the risk will be shown based on how many people are being hospitalized and how many people continue to die. And that's in our community. So, for example, today in the city of Houston and Harris County, we're seeing about 100 people a day get admitted to hospitals, and we're reporting about 10 deaths per day. And, to me, that's a lot still. And if there were 10 drive-by shooting deaths per day, there would be outrage. If there were 10 drunk driving deaths per day, there would be outrage. But society, I'm wondering, are we getting to the point where we are comfortable accepting 10 innocent deaths per day from COVID because we don't want to bother wearing a mask? And that's the question from where I sit.
You're actually repeating a conversation that I had with one of our mutual colleagues and friends who's an epidemiologist when we were theorizing about where we were going to be in the fall and in the winter. And the big question was whether or not we as a society or as a community would be willing to accept those 10 deaths and X number of cases. I hope not. Please update the numbers locally and explain what the RT productive rate is.
The numbers locally, we just talked a little bit about 100 admissions a day, about 10 deaths per day. Our positivity rate has been bouncing in the 8 to 10% range between the city and the county. The R value is a complicated number. It is a estimate as to how active the viral spread is in the community. And the rule of thumb is if it's greater than 1, the virus is spreading. And if it's less than 1, the spread is decreasing. It is a reflection of the virility, if you will, of the virus itself. So if you, like when we first had the virus in the community, it had a value of around 2.4, 2.5, which meant it was spreading rapidly. One of the highest values for any disease is measles, which is in the 10 to 15 range. And so now, as we're using it today, it's not only a reflection of the infectivity of the virus itself, it's also a reflection of our methods to try to slow it down, which includes wearing masks, social distancing, vaccination, and so on and so forth. So it changes, and it's calculated. It's a very difficult calculation. So you're going to see similar places give slightly different values in the calculation. I don't know if that answers the question very well or not.
Governor Abbott said Texas is close to herd immunity. True?
We're closer than we were when we were at 0, when we had no vaccine.
But we're not. But we're not at 70 to 80% of the population.
We're not, at least for the county. The last numbers that that I saw are somewhere around 40-45%, and I think have had at least one dose, and much less than that have had the full 2 doses. And so I think Texas is kind of around the same. So we still have a ways to go, unfortunately.
Disinfected surfaces to prevent COVID is often all show CDC advises, and people who obsessively disinfect surfaces may be doing more harm than good. True or not?
We've learned that the ability of the virus to spread from inanimate surfaces is lower than what we had anticipated based on our experience with things like influenza and the common cold. So that's good news. I don't know about all for show. In the beginning, we didn't know any better, and so we're being responsible. And I don't know about doing more harm than good. I don't know that it's doing more harm than good.
Are airlines contacting passengers if there's a positive case reported?
I think they're supposed to be. They're still supposed to be doing contact tracing, but I don't know how that process is happening right now. But I think as far as we know, it's supposed to be.
Is it necessary
the passenger has to report the positive first back to the airline?
Absolutely. Is it necessary to wear a mask while you're outside walking?
Only if you're unable to keep yourself physically distant from those around you.
Brazilian children seem to be experiencing a rise in multi-symptom inflammatory syndromes, and symptoms can take up to 6 weeks before showing. Is that research?
So we are seeing Brazilian children having more cases of MIS-C or multi-system inflammatory disease syndrome in children. But it's not unexpected, because it's usually, what we know is that it's usually a percentage of the population that gets COVID-19, and the kids will develop MIS-C. And unfortunately, what we're seeing in Brazil is that there's just huge numbers of cases. And so there's always going to be a percentage of those kids, unfortunately, that do get MIS-C. And one thing that is really tragic about MIS-C is that the child could have had asymptomatic COVID. They may not have even known that they had COVID. They may have really mild COVID, and then they develop MIS-C. And the biggest complications that you can get from MIS-C are heart complications.
Okay. In theory, could a booster shot safely protect against all variants, or do vaccines need to be targeted for each one?
So generally, a booster will probably protect against multiple variants. In fact, our current vaccine protects against multiple variants. The problem is that as variants keep developing, eventually you'll run the risk of needing a new vaccine, because the variant is so different from the ones that the current vaccine covers.
Do y'all have any information on the BV1 variant that was discovered at A&M?
Not very much. No, I don't.
Not very much, yeah. Just that it was discovered and they're looking into it.
If I stay at home and get my groceries delivered, should I get a vaccine?
So I would say yes, because we've had many stories of people who are very obsessive, compulsive about protecting themselves, and they still got sick. This virus it is pervasive, it is innocuous, it seems that, the more you do to protect yourself, the less your chances are, but they're not zero. So I would recommend you still get the vaccine.
Who manages and enforces the airport protocols?
So that is a federal mandate, and so the federal authorities at the airports, including the FAA and Customs and Border Protection, whoever else, I would think, but also the airport, because it has to work with federal government. So there's probably multiple layers of enforcement at the airports.
My last comment actually, the new opening line when meeting a new person seems to be, so have you gotten your vaccine yet? I'm tempted to create a wearable piece of jewelry from my vaccine card. Would you like one?
We would love one.
I would like to see what it looks like. That card is ugly. Well, that's all the questions I have for now. I want to thank y'all for joining our COVID-19 talk with our local health authorities, Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the city of Houston. Thank you to past President Kathy Feniger, Rotary Club of Houston, for providing us with questions, and for Morgan Ash for helping us put this together. I'm Stephen Williams, the Director of the Houston Health Department. Take care.